Good afternoon, morning, whenever you're watching this video. Mayor Katie Rosenberg here with the amazing twofold. I really didn't come up with a name for the two of you, but
Double Trouble.
Amazing, yes, Double Trouble from the Marathon County Health Department. Laura Scudiere, Aaron Ruff. How are you?
We're good.
Good. Happy to join you gals. I'm a fangirl of the show, so I'm happy I can join you guys.
Oh, man, I'm glad you're here too, because actually you are bringing up a really important question that, I don't know, maybe I spend too much time on social media because that's where I'm gathering these questions, but there seems to be kind of a theme among some demographics that they don't need a vaccine, they have an immune system, maybe it's a certain, I don't know, young dude demographic. I'm not pointing fingers. I'm just saying, like, maybe we need a little more encouragement for some folks. So I don't know, Aaron, maybe you could just, I don't know, help us out here.
Yeah, I'm with you, Katie. I'm actually I'm one of the data geeks over at the health department. One of the things that I've been noticing is that men are kind of falling behind women as far as getting their vaccine. So right now, only about one out of every 3 men in Marathon County have gotten at least 1 dose of vaccine, whereas women are about 43%. So we have some work to do, men in Marathon County. You know, we made up 48% of the COVID cases, but only 1 out of 3 of us has been vaccinated. So I wanted to come on today and share my vaccine story because I'm a 32-year-old dad of 2 who never had COVID. I consider myself a healthy guy, and I actually just got my 2nd dose of the Pfizer vaccine yesterday. So I just want to let all my my peers and males out in the community know that vaccines are safe and effective. The only side effect I had was a little bit of a sore arm. And I basically blame that on myself for not exercising. So it's painless. It's easy. I went to the AMI clinic at North Central Technical College, which is awesome. They now do walk-ins. So for the men that don't want to pick up a phone or schedule an appointment, you can literally walk in, and I actually did that yesterday for my 2nd dose. I walked in and got in right away and got my appointment done. So
and Aaron, how long did it take you from start to finish?
It took me 20 minutes. You're in and out of there in 20 minutes. So for the men in the community, you know, stop out on your lunch hour. The clinic happens to be right next to Fleet Farm. So if you're headed to Fleet Farm, stop in, get your vaccination. It's super quick and easy. And if I'm a betting man, which I am sometimes, the majority of you men out there have already received the vaccine. When you were a kid, you received the hepatitis B vaccine, rotavirus, measles, mumps, rubella, tetanus. You may have gotten your flu shot in past years. Vaccines are a normal part of life. They're a normal part of keeping yourself healthy, whether you're an 80-year-old woman or a 32-year-old man. So I just want to encourage everyone, especially my male peers out there, to get vaccinated. Check the box, you know, so you can travel. You don't have to quarantine. There's a lot of benefits. So show up and get vaccinated.
I do like the challenge that you're issuing. I mean, usually I'm all about like women over, you know, let's go, woman power. But I would love to see the data and how we challenge each other to be healthier together. So.
Yeah, like I said, I'm a little disappointed that more men aren't showing up for their vaccine. And you know, you might be a little hesitant, I understand, but realize now as we go into May, I mean, the vaccine eligibility is open to everybody. So if you're over the age of 16 and you're a male and you want to get vaccinated, it's very easy to do that. Again, I'll put a plug in for the AMI clinic. You can walk right in Tuesdays through Saturdays, show up, get vaccinated. Side effects will most likely be minimal.
Dudes, get it done.
It's free.
It's free. Yeah. I mean, it's like, to me, it's like no harm, no foul. You show up, you get your vaccine just like you have for the first 32 years of your life, and you just go on with life, and you know you're protected. You know you're protecting your family. You get a cool sticker if that's your thing, but
it is my thing. I've also heard about people on some of the dating apps putting in their profiles if they're vaccinated or not. So I don't know. Just throwing it out there.
That's if you're single and in the dating pool, you're looking for some extracurricular activities this summer, get vaccinated, and you know.
Is this one going to be approved by?
You may find the love of your life.
Okay. Awesome. Thank you so much. I love that you're challenging other dudes and our community. You just got to all get it done. Okay, so I got another question. Appreciate it. Herd immunity. This is the question I'm getting. What do we know? When do we reach herd immunity? When can we check the box that we're set? Give me your deets on this.
So the concept of herd immunity is really like a public health term that we use, and there's some science behind it. And what it means essentially is, if you're thinking like the way I like to think about it is like a herd of cows. If you're thinking about a herd of cows, you want to immunize the ones that you can, because there are certain cows that you can't, like the baby cows. You might not be able to immunize, and you want to protect them. So if you get enough of the adult cows, then the disease can't go between all the other cows, and it wouldn't get the baby cows. So really, it's about protecting the most vulnerable among us, in addition to protecting the healthy ones. So that's what essentially herd immunity means, at least to me. I don't know, Aaron, if you have any better ways of explaining that, now's your time.
No, I think that's good. And I think, another point too is like knowing that I have the vaccine now, I feel protected. Like I know I'm protecting myself. I know I'm protecting my family, my young kids who cannot get the vaccine. And so I feel like that level of protection is important. And that's really what herd immunity is about, is getting enough people protected where people can feel safe. And another reason, again, another plug for men, is I'm a man and I hate being sick. I hate it. So getting this vaccine and knowing that the chances of me getting COVID are like super, super small. Like I love that. Like I don't want to get COVID. I'm glad I didn't get it. I don't want to get it. So you're protecting yourself, you're protecting others. It's a no-brainer. Get it done.
Yeah, and Aaron, I mean, you're protecting your kids, in getting because your kids can't get the COVID vaccine right now.
Yep.
I have a child. Like if you have children in your life, if you have elderly people in your life, you're protecting the most vulnerable among us. Not everybody can get the vaccine right now. And so there's, anybody under 16 can't get it right now. Quick plug again for the NTC site though. If you're 16 or above, you can go there and get your vaccine. So, we mentioned this last time, Katie and I, because if you're into not the same extracurriculars as we were just mentioning.
Basketball, soccer, baseball,
theater.
Yes, theater, band.
Yeah, like you can still participate. And then the other thing is, if you get your vaccine, then if somebody around you gets COVID and you've been exposed, you don't have to quarantine anymore. And so like that's a huge benefit to you, that especially these kids that are doing these extracurricular activities like sports, that they don't have to then quarantine and miss out on stuff. Yeah,
agreed.
So
awesome.
Anyway, I've heard the number of what we're trying to aim for herd immunity. There's no I haven't seen any super official percentage, but I have seen anywhere from 70 to 90 thrown around. And I think we're at 30 some percent. Aaron, do you know offhand how much percentage we are at?
37 only have one dose. So we have ways to go. I mean, and again, there's plenty of vaccine available. So if you're somebody that's on the fence, male, female, or anyone else, there's plenty of vaccine here in Marathon County. So get it done.
Put it in your body. Okay, so I'm interested in where I don't know I don't know why that came out that way, but I'm excited. Next week we're gonna have a higher percentage of people vaccinated, maybe even fully vaccinated, because next week will be the first week where everyone was eligible, could get their first dose last month. So anyway, very excited. Okay, I do have another question. Again, social media informed question about some people getting bills, and we talked about how this was free. So why are they getting billed, and what the heck?
Yeah, there's some healthcare organizations are taking insurance, and the reason is because they can charge your insurance, but you will have no bills come to you. You should not have any charges whatsoever. The insurance company should cover any kind of fees. There's no deductibles or anything. Nothing should come out of your pocket. It should be this big companies that are paying for this. And so on occasion, something will go wrong and a bill will come to a patient. I can tell you, if I've spoken to all the healthcare providers, the big systems in town, And they say if you get a bill from them, it's a mistake, it's an error, and you should call the number on the bill and they will immediately take care of it for you.
Okay, so quick call, no bill. Awesome. Yeah, and when I got my vaccine, I did not have to pay anything. So you were exactly correct.
Yay. And Aaron, you didn't have to pay anything either.
Yep. Another plug for AMI is there's no exchange of insurance information at all. Just show up and get it done.
Yes. Okay. I think we got 3 questions plus a lot of information regarding our expectations for extracurricular activities this summer. So yeah, awesome. Thank you both so much. I think we had a lot of good information today.
Thanks, Katie.
Thanks all. Appreciate the time.